Hi, my name is Ashley Cifuentes, and this is a trauma assessment for my clinical hours. I've determined my scene is safe. My presence is needed. There's no need for backup. There is only one patient, and there is PPE I have taken to put gloves on. And the nature of illness is that he fell and hit his head. The mechanism of injury is that he fell and hit his head after falling off of the monkey bars. And there is no need for spinal immobilization. Okay. My general impression of my patient is that he is a 10-year-old who fell off the monkey bars and is clutching his head. He is about 120 pounds. And his level of consciousness is alert. His chief complaint is that he hit his head. There is no apparent life threats as there is no obvious bleeding. Hi, sweet pea. My name is Ashley Cifuentes. I'm gonna be your EMT. May you take your hand off real quick? There's no bleeding. I'm gonna put your head up, okay? I'm gonna look at your throat, all right? Thank you. It's open, the airway's patent and will stay patent. His breathing looks adequate and equal rise and fall of his chest. Doesn't look labored or any other sign of agonal breathing. There is no adjunct needed, so I would not insert an OPA or an NPA. He does not require oxygen. I'm going to manage any injury, which there is no cerebrospinal fluid coming out of his ears or his nose. So I'm going to move on. I'm gonna check his pulse. Can I see your hand? Thank you. His pulse is regular and strong. There is no bleeding present, but if there were, I would assess and control any needed. And then his skin is pale, or it's pink, dry, and warm. He does not need shock management because he does not have any major bleeding. And he does not exhibit any common signs of shock. Okay, hi. Can you tell me, does anything hurt besides your head? Can you keep your head up for me, babe? Does anything hurt besides your head?
No.
Okay, cool. Do you feel like sick or anything?
No.
Okay, cool. I'm gonna start, I'm gonna feel around your head and move my way down your body to make sure that nothing else got hurt when you fell off the monkey bars, okay? So I'm feeling his head around for any depressions or deformities. And I'm looking for cerebrospinal fluid in the ears. I'm feeling his neck. I don't see any step-offs, but I'm gonna keep feeling around and I'm gonna feel his facial muscles for any bones broken. I feel his neck. I don't see any JVD. I'm gonna take my pen light at this point and shine it. His pupils are equal, which indicates no head trauma. Can you sit up straight for me, babe? I'm gonna squeeze so I can make sure. I'm gonna palpate your abdomen. Does anything hurt? No?
Hmm?
All right, cool. I'm gonna have you lay down for me. Thank you. I'm gonna repalpate. Pelvis is intact. So are you allergic to anything? Medications, animals, allergies to
Nope.
latex?
No.
Can you wiggle your toes for me? Can you tell me which toe I'm squeezing?
The pinky.
And I'm gonna find the pulse Pulses present. Can you wiggle your toes for me? All right, which toe am I pressing?
The big toe.
I find the pulse is present. I'm gonna continue on with the trauma assessment on his arms. I'm gonna take his pulse. Can you wiggle your hands for me? Okay, which finger am I squeezing?
The pinky.
Okay, perfect. I'm gonna feel his other arm. Okay. I'm gonna take his pulse. Present. Can you wiggle your hands for me? Which finger am I pressing?
The ring finger.
Perfect. When did you last eat?
5 hours ago.
When, okay, good. What were you doing that led up to you falling?
I don't know, I was just playing on monkey bars and I slipped.
All right, have you slipped off the monkey bars before or fallen and hit your head before?
No.
Alrighty. On a scale of 1 to 10, 1 being like there's no pain at all, 10 being the worst pain you've ever felt in your life, where does it hurt?
6.
A 6 out of 10, okay. Let's see. What kind of pain is it? Is it like a throbbing pain? Is it kind of like, feels like someone's poking you in the head with a pen?
No, it just stings.
It stings? Okay. Let's see. Does anything make it better? Does anything make it worse? Did it feel better when you were sitting up versus sitting down?
No, the same.
Okay. So how long have you had it? When did you fall off the monkey bars?
10 minutes ago.
Okay. So I'm gonna roll you over, okay? So I can check your back. Just to make sure you didn't hurt anything else. Ready? I'm gonna count. 1, 2, 3. Okay. So I'm feeling his back for step-offs. I would palpate the butt area. Okay. I'm gonna carefully roll him back over. In 3, 2, 1. Good job. And then I'm going to call the hospital and inform them I'm on the way with the pediatric patient and inform him of the vitals, the results of my assessment, and his status. And then I'm going to reassess every 10 minutes, 15 minutes, because he is a stable patient. Now I would transport him.